This slide's presentation will cover the currently available treatment options for patients with Huntington's disease. This slide shows the options. First is going to be pharmacology for symptom management, and the kind of drug that's used is going to depend on the kind of symptoms that the patient is having. If you remember from the basal ganglia disorder slides presentation, I talked about the fact that Huntington's patients don't all present in the same way. There's going to be motor changes, mainly chorea. There could be cognitive changes as well as psychological changes that are present, all in varying degrees depending on the patient. So, if the patient is experiencing chorea, they will take anti-choreic medications. And for the psychological symptoms, there's antidepressants and or antipsychotics that can be used. I'll talk about these in a future slide. In addition to pharmacology, for symptom management, there's also the option for physical therapy, and the physical therapy is going to be specific for the patient's symptoms as well as the stage of the disease. Again, I'll talk a little bit more about physical therapy options later in the slide presentation. And finally, the individual may definitely benefit from any kind of counseling and or support group due to this diagnosis. This slide lists some common Huntington's medication. In general, there are differing categories of drug. Over on the far left-hand side of the slide, you can see that if it's a dopamine-depleting drug, then that's going to target chorea. An atypical antipsychotic is going to target both chorea as well as any psychological symptoms. So these kinds of drugs would be killing two birds with one stone. And then finally, another category for chorea as well as psychological issues are going to be the dopamine blocking drugs. Each of these categories of drugs has some significant side effects, which are listed on the right-hand side of the slide. The dopamine depleting alone has depression as a side effect. And all three have something known as extrapyramidal symptoms, and extrapyramidal symptoms are nothing more than increased tone and or presenting like a Parkinson's patient. Okay. Also, they have a side effect, all three have a side effect of akathisia, which is going to be feeling restless or unable to sit still. Okay. Other categories of drugs to target depression are going to be your selective serotonin reuptake inhibitors, or your SSRIs, as well as other kinds of antidepressants that are listed below this. You should know that these antidepressants have side effects that include insomnia, GI upset, motor restlessness, weight loss, dry mouth, anxiety, as well as headache. The physical therapy options for treatment of a patient with Huntington's are shown on this slide, and each of these options is going to depend on the stage of the disease. And if you look on the far left-hand side of the slide, you can see the stages I've listed are the pre-manifest, also known as the premotor stage. The person has the medical diagnosis of Huntington's, however, they're not displaying any motor symptoms as of yet. Early to early mid, and then finally late mid to late. These are all different stages of Huntington's, and I've discussed these previously in the basal ganglia disorder slides presentation. Okay, so the classification of function for the pre-manifest stage is simply medical. As I mentioned, the person has no motor symptoms yet. And the management strategy is actually just preventative. And the goal is to delay the onset of any mobility restrictions that might occur in this patient. Okay, the next stage, the early to early mid, the classification of function, they're going to present with impairments and activity limitations, and the main problems are going to be balance, weakness, dystonia, and chorea. The management strategy for physical therapy here is going to be restorative. That is, if there's any way we can get that person's function back to where it was in the pre-manifest stage, that's what we're going to try and do. So if there's weakness, we're going to do some strength training. If there's balance, we're going to try and do some balance training. Okay, the main goal here is to maintain that person's function for as long as possible. Okay, finally, in the last stage, we have the late, mid to late. There's going to be activity limitations, impairments, and participation restrictions. Main problems are going to be falls, mobility problems, postural changes, pain, decreased range of motion, as well as respiratory problems. And the management strategy that we're going to use is going to be supportive in nature. This is the patient population where you're going to do some respiratory therapy and recommend breathing exercises. You might also use some postural control devices to help maintain good posture and range of motion. You may also want to do some prescriptive wheelchair seating. Okay, and the main goal here is going to be to limit the impact of all of these complications. Recently, there was Huntington's clinical practice guidelines that were published. These clinical practice guidelines are linked in the schedule in the Moodle course. And what they found that there is strong evidence for prescription of aerobic exercise. This exercise should be moderate intensity, and they consider 55% to 90% heart rate maximum as moderate intensity. In addition to the aerobic activity, then they also are recommending upper and lower strengthening exercises, so resistance training. And these exercises should happen 3 times a week for a minimum of 12 weeks. These are going to help improve fitness or stabilize the motor function. Okay. In addition to this, there's also strong evidence for supervised gait training in this patient population. Clinical practice guidelines also had some weak evidence, and the weak evidence was mostly for balance exercises. The main reason why there is weak evidence here is that the balance actually improved. However, there was no effect on this improved balance with the reduction of falls in this patient population. So there is some weak evidence for balance exercises, and it won't hurt, but it might not decrease the patient's fall risk. And there's also weak evidence to provide breathing exercises, so inspiratory and expiratory training to improve the strength of the respiratory muscles as well as the patient's cough effectiveness. And hopefully you'll go over some of these kinds of exercises at cardiopulm this semester. And then finally, there's really no recommendation, and that's only because there isn't enough evidence to recommend a postural control program using any kind of positioning device that might help the person's posture. Okay, also, they realize that all the care plans for Huntington's patients should be individualized, especially when it comes to end-stage disease. You should be doing some sort of appropriate positioning and seating through wheelchair. Also, any kind of active movement that the person is going to be able to do is going to be recommended. Breathing exercises as well as patient as caregiver education. Okay, you want to be sure that you're training the caregiver to provide strategies for maintaining appropriate activity and participation in whatever that person likes to do for as long as humanly possible.